afternoon. My name is Rose Crum-Johnson, and I am the administrator for the Atlanta Regional Office of the Centers for Medicare and Medicaid Services. The purpose of today's satellite broadcast is to define and clarify the requirements for the Health Insurance Portability and Accountability Act, the administrative simplification parts of that, commonly referred to as HIPAA. HIPAA will establish national standards for transmitting healthcare claims and other administrative transactions electronically. These national standards will simplify and improve efficiency within the administrative aspects of the healthcare industry. By ensuring consistency throughout the industry, these standards will make it easier for health plans and physicians and hospitals and other providers to process claims as well as other transactions electronically. In previous broadcasts, we've talked about how HIPAA will revolutionize healthcare electronic data interchange and reduce costs, time, and errors. I like to compare HIPAA to the changes we've seen in the banking industry over the past few years, and it is an analogy worth repeating. Just think about it. We used to go to our local banks with passbook in hand to make deposits and withdrawals and conduct other business on our accounts. But today, we electronically access our accounts from a home, a phone, virtually anywhere, and conduct all kinds of financial transactions quickly, conveniently, and securely. What made this possible is the banking industry's e-commerce platform that resulted in a home and community-based program that has changed the way we bank. This e-commerce platform has in turn had a positive effect on transportation, on shipping, on commerce, on stock brokerage, and a host of other industries. HIPAA is an important step in building an e-commerce platform for healthcare that will move information, move money, and enable healthcare services to be delivered through a similar home and community-based platform. This will free up funds currently directed towards administrative costs and redirect them to essential patient care services, an estimated $30 billion in savings over 10 years. I encourage you to approach HIPAA as an opportunity to streamline some of the processes in your offices to prepare your organizations for the future of healthcare. The primary focus of today's broadcast is a discussion of various electronic data interchange solutions available to providers, commonly referred to as EDI. Since CMS is considered an industry leader, we believe it is our responsibility to assist the healthcare industry during times of healthcare change and growth. Thus, we are working with our industry partners to help providers understand these regulations and the impact they will have on their organizations. Today's presentation will also include a high-level overview of the HIPAA administrative simplification requirements overseen by CMS, along with the known timelines. Then our industry partners will present their perspectives on what you should expect from your software vendors, clearinghouses, and payers. We hope today's presentation will enhance your understanding of the administrative simplification regulations, as well as provide you with tools and resources to facilitate your compliance. We have a full program today, so let's get started. On behalf of CMS, our regional office, and myself, thanks for joining us. We look forward to working with you.
My name is Gloria Steinberg, and I represent First Coast Service Options Incorporated. We're the Medicare intermediary for Florida and the Medicare carrier for both Connecticut and Florida. My intent today is to provide you with a high-level overview of the entire HIPAA AS regulations, along with the known timelines. If you will follow with me on the screen, you'll see a chart. HIPAA AS stands for the Health Insurance Portability and Accountability Act / Administrative Simplification. And as you can see, the 5 sections of the Administrative Simplification fall under Title II of the original HIPAA law, which was passed in 1996. The purpose of this original set of regulations was the beginning of a congressionally sponsored incremental healthcare reform. If you will follow with me, we will trace the law from its inception to the present. The upper row represents the original HIPAA law of 1996, which contained 5 sections. The main sections were health insurance access, portability, and renewal. The second was preventing healthcare fraud and abuse. The third was tax-related, and the fourth, group health plan and then revenue offsets. This initial set of regulations primarily addressed the portability of health insurance, and it produced such beneficial reforms as COBRA. If you will now look at the second row under fraud and abuse, you will see the Administrative Simplification Regulations, or AS, under Title II. This is the fraud and abuse section of the original set of laws. The administrative simplification provision of HIPAA was implemented in an effort to improve the efficiency and effectiveness of the healthcare system. We do this by ensuring the consistency throughout the industry, the transactions and code set standards. This will make it easier for health plans, physicians, hospitals, and other providers and suppliers to submit and process claims and other transactions electronically. The law also requires the adoption of privacy and security standards in order to protect the personal health information we're transmitting. It is important to note that HIPAA AS is not a CMS mandate. It is a federal law. CMS, as the largest health plan in the United States, is itself a covered entity and as such is subject to the same regulations as every other covered entity. Let's look at a breakdown of the regulations under HIPAA AS. The 5 sections of the AS portion are number 1, electronic transactions, which we discussed today. These provide for the adoption of uniform transactions for the transmission of claims and other healthcare information, as well as standardizing all the code sets that we use in those transactions. The second section deals with privacy, and this provides rules to regulate the use and disclosure of private health information by covered entities. As many of you know, covered entities are defined as health plans, all clearinghouses, and all providers who transmit HIPAA-defined transactions electronically. And further, those providers who engage other entities to submit electronic transactions on their behalf are also considered covered entities. The third section deals with security, which will regulate measures to protect electronic information. The fourth section deals with identifiers. This will help standardize the identification numbers that are used by all healthcare entities. And finally, revenue offsets. The final regulations have only been issued for the first 2 set of laws and a portion of the fourth, as you can see on the chart. Under HIPAA, covered entities, which are those obligated to obey these laws, have 2 years from the date of each final regulation to be in compliance with that regulation. One current exception is the transactions rule, which is now subject to a 1-year extension for those entities that qualify. At this time, the only final rules that have been issued are the transactions, the privacy, and one of the identifiers. This identifier is the EIN, or the Employer Identifier Number. The security rules have been proposed, with the final rules expected by the end of the year. Many of the remaining rules are expected to be published during the first half of 2003. I would like to caution you, please monitor the SHARP website and the WEDI SNP website for many of your upcoming compliance dates and changes. SHARP stands for the Southern HIPAA Administrative Regional Process, and this is a public-private partnership. It's a work group dedicated to tell you all about HIPAA, to make sure everybody has all the current rules. The WEDI SNP, the WEDI stands for the Work Group for Electronic Data Interchange, and the SNP stands for Strategic National Implementation Process. This is a work group from the very beginning that worked on all the transactions and code sets and is dedicated to give you information. So both of those websites are very important to monitor. To recap then, the current compliance date for the published final rules are October 16, 2002 for the transactions rule, except for those who apply for an extension, and they will have a delay until October 16th of 2003. Again, remember, testing must still begin on or before April 16th, 2003. April 14th, 2003 is the compliance date for privacy, and July 31st, 2004. I hope this overview gives you a basis for following the upcoming panel discussion. At this point, I'll turn it to you, Kei-san.
Before we begin our panel discussion, I'd like to take a few moments to go over some terms that we will discuss throughout this panel discussion. The first one being covered entity. A covered entity is a health plan, healthcare clearinghouse, or healthcare provider who transmits health information in electronic form. The date by which a covered entity must comply with a standard implementation, specification, or modification will be referred to as the compliance date. Now let's define entities considered covered under HIPAA a little further. A health plan is referred to as an individual or group plan that provides or pays the cost of medical care, such as HMOs, health insurers, group health plans, including employee welfare benefit plans. A healthcare clearinghouse is a public or private entity that either processes health information going from a healthcare provider to a payer. Throughout our panel discussion, the term providers or healthcare providers may be used interchangeably. When we use the term provider or healthcare provider, we're referencing any healthcare provider who transmits any health information in electronic form in connection with a standard HIPAA transaction. Now I'd like to take a moment to introduce our panel members for today's broadcast. We have John George, who is the Senior Vice President of Per Se Technologies. John, would you tell us a little bit about your organization?
Sure, Kaysan. Per Se Technologies is a national software and provider services company. We focus mainly on software, physician billing, and EDI transactions.
Okay, thank you. We also have with us today Susan Miller with the Kearney Group. Susan, would you tell us a little bit about your organization?
Certainly, Kaysan. We are a little consulting company that focuses entirely on the provider community. We have spent the past 4 years talking to the provider community, and I am also invested in WEDI, and I'm going to share some of those things with the audience today.
Okay, thank you. We have Debbie Miser, who's with WebMD. And Debbie, would you tell us a little bit about your organization?
Sure. WebMD is a very large national clearinghouse. We provide desktop solutions for providers, and in addition to that, we have a very large clearinghouse part of our business, and I'll be representing the clearinghouse piece today.
Okay, thank you. And to my right, I have Gloria Steinberg, who's here with First Coast Service Option. Gloria, would you tell us a little bit about your organization?
Certainly, Kaysan. First Coast Service Options is the Medicare contractor and intermediary for Florida, and also the contractor for, or the carrier, I'm sorry, for Connecticut. We process, as a matter of fact, you might as well say in Florida, Medicare are us. We do all the billing and everything associated with Medicare in the state of Florida. I am part of the education and outreach team from FICSO.
Thank you, Gloria. And to my left, we have Wayne Gaff, who is the HIPAA Program Coordinator for Blue Cross and Blue Shield of Florida. Wayne, would you tell us a little bit about Blue Cross?
Certainly. Blue Cross and Blue Shield of Florida is an independent licensee of the Blue Cross Blue Shield Association, and we offer a variety of healthcare products and services to the insureds within the state of Florida. And today, along with Gloria, I'll be representing the payer, the payer perspective.
We pay the bills, right?
Yes, we certainly do.
Well, we'd like to thank each one of you for joining us in today's broadcast, and we know that you took some time out of your busy schedule to be here with us today, and we thank you for that. We'd like to first of all thank Gloria for that excellent presentation that she did, giving us a high-level overview of HIPAA administrative simplification. At this point, I'd like to ask, do providers really understand the transaction cycle?
Well, Kaysan, I think we're going to talk today specifically about the transactions in HIPAA, and I want to outline a little bit this morning about the flow from covered entity to covered entity to covered entity. If we start on the provider side of the life, they have to collect the appropriate data and code sets to pass on to get paid. In today's world, they're not collecting the entire data set that they're going to need for HIPAA, but they are collecting a number of data elements that they're not going to need, so they're going to have to do a review there before they pass on the data. They may ask their partner, a billing service, to help them with this data and code set issue before they pass on to a clearinghouse or a payer. And the clearinghouse is then going to take the data that is passed on from the provider and put it in the appropriate context, the appropriate format, the appropriate envelope to pass on to the payer to be paid. But there are some additional things that the payers are going to do. Isn't that right, Gloria?
Absolutely. And one of the remember that HIPAA is not going to change the way we really pay the claims for the most part. We're still going to be looking for a relationship between the service provided and the code that you use, the place of service code, that everything is still proper in your claim. And remember, all the edits that were there before are still going to be there. HIPAA is, in addition, a different format. Mainly you'll be looking for a format. We'll still be looking for those same things.
Okay. Well, what transactions and code sets are mandated under the HIPAA regulation?
Well, if you start from the beginning of the life cycle of a service being provided to a patient, the first transaction that's mandated in HIPAA is your eligibility transaction that flows from the provider of service to the payer. Checking to make sure, very similar to the credit card check that you get when you go into a store to say, do I have enough credit on my card to buy what I'm buying? The eligibility transaction is very similar to that. Is this patient insured within this health plan? Following that, once the service is provided to the patient, you now want to make sure that you get paid for that, so you submit a bill or the claim submission transaction, which is also part of the HIPAA mandates for the providers. In response to that, you're expecting a payment. So there's the remit advice or the claim payment transaction that impacts the provider. Once you've submitted your claim, if you haven't received payment, you want to know what the status of this claim is. Is it pending for additional information? Has it been denied? Has it been paid and I just missed my remit? So you have a claim status transaction that flows, again, from the provider to the payer and then the response back. There's one other transaction that impacts the provider, and that's the health services review or your authorization referral transaction, mostly for the managed care types of situations where the service has to be pre-authorized by the payer. There are two other transactions that are mandated by HIPAA, the enrollment and the premium payment transaction. Those flow between the payer and the health plan sponsor, the employer or the group Medicaid. And again, those don't impact the providers. But those are the transactions. But within each of these transactions, there are specific codes mandated within the regulations and within the implementation guides. And Sue maybe can fill us in a little bit more about that.
That's right, Debbie. The provider is going to have to use the standard codes that are within the regulation as well. The one major impact that they're going to have to do, they're still going to use CPT codes and the ICD codes, but local codes are going to go away. So this is going to impact what providers are going to be submitting to the clearinghouse and on to the payer. There is a project ongoing nationally to review all of the local codes and make them part of the standard code sets, but I'm not assured that that is all going to happen at the appropriate implementation point for the transactions. So everybody who is impacted here is going to have to talk to their payers and find out what is actually happening in their specific circumstance.
You know, Kaysan, as a provider, hearing all this, you get a little nervous.
Right.
There's a lot of transactions that you're looking at. You know, how do I start? Where do I start? What's most important to me as a provider? What I would concentrate on are two specific items, and that's the claim and remittance. I mean, when you look at what you need to do for your business, concentrate on getting that claim in the correct standard format to the payer, so you get payment. So you know your business continues to thrive. Remittance also is very important. Making sure today a lot of software programs are taking remittance back and doing auto posting capabilities. And a lot of providers are depending on that. They've looked at their staffs and have been able to automate a lot of this process coming back through. So if you concentrate on what we call the 835, the 837, the claim and the remit, I think that's probably the most important key to your business. Some of the things that Debbie brought up, especially the eligibility piece of that, is really important also. If you're going to look at HIPAA from the overall aspect of your business and what it affects, eligibility is an important piece of that. I don't think a lot of providers take advantage of that eligibility piece. To actually, when that patient comes in, to check that eligibility against the payer's records. That would help them tremendously. So, you know, to suggest that they concentrate on the eligibility piece, the claim and the remit, is really important for them to understand. When you see all these sets coming through, those are the three things. If you have or are running late in terms of your readiness for HIPAA, those are the three things that I would suggest concentrating on.
Absolutely.
John, I agree with you. And the WEDI SNP transaction white paper on sequencing says just exactly that, that we hope the industry will follow the sequencing, but the focus first, of course, is getting the bill out the door and getting the payment in and doing the eligibility, which enhances getting the claim out the door and the remit back in.
So what I'm hearing is that providers need to focus on the transactions that affect their offices right now, and we've identified those as being the 837, 835, and also eligibility. Is that correct?
I would say that's correct. HIPAA can be scary. If you start looking at the websites, there's a lot of good information on websites that can get you started in understanding these transactions. We talked about WEDI, SNP, SHARP. Go to those websites. Use those websites. They are built very well for navigation of information. That's where you start. Get that information. Understand the data that you're currently collecting and how that relates to the changes that HIPAA is requiring in their standard format. That's where I would start.
Okay. Well, everyone wants to know, is HIPAA a CMS mandate?
No, Kason, CMS did not mandate HIPAA. As a matter of fact, it is a federal law, and CMS is a covered entity just like all of you are covered entities out there. They're subject to all the same regulations and all the same deadlines and compliance dates and probably the same problems, only on a larger scale. Being the largest health plan in the United States, obviously they've taken a lead, but they still have to obey all the laws just like everyone else.
Gloria, what are they doing to help their providers understand what the requirements are? Are there tools available for them? Will there be tools available for them?
Well, for one thing, they've taken the industry lead, and we've done a lot of, I've helped them together, we've done a lot of outreach in this area. They also have, as we talked about earlier, a model compliance plan on their website to help them get the delay. They are having links to all the good information to all the websites like OCR and like HHS and like WEDI and SHARP. And ongoing education is the key, and we're very much involved in that with them. As an industry leader, we're going to keep trying to do our best for that.
Yeah, CMS is doing outreach across the nation through their regional offices, Debbie. Mm-hmm. And while they are only a covered entity, they have taken this additional step to help bring the providers up to an awareness and to help them take the first step in assisting them to prepare and to accomplish HIPAA.
Well, now that we know that this is not a CMS mandate, are commercial companies required to follow these same regulations?
Kayshawn, all covered entities are required and are impacted and must comply with the HIPAA regulations. And again, the covered entities being payers, clearinghouses, and health plans. Payers, interesting enough, may have as a large a challenge as any one of the covered entities in that we must comply and must be able to send and receive compliant transactions, all the compliant transactions by the respective compliance dates. Providers, as John was saying, do have a little bit of flexibility in opting whether to use all the transactions or a certain subset. I think we would all agree that electronic communications, electronic billing is going to help us achieve some of the benefits of standardization of the HIPAA mandates. But it's going to take us, quite frankly, and it's going to take the industry a little while to get there. Payers are going to have to set the pace, set the bar high, come into compliance with all the transactions, and the industry, the rest of the industry, providers, clearinghouses, are going to have to come along and working together in a partnership ultimately implement all the regulations as intended.
Hey, Wayne, what do major payers similar to Blue Cross do or planning to do in regards to extensions?
We, like most of the covered entities I am familiar with, will be filing an extension. We will be filing an extension to ensure that we, as well as all of our business partners that we interact with, are able to transact business in a manner as intended by the legislation. Again, it's very challenging, as we've talked about and as we have been involved in HIPAA for a number of years, all of these organizations here. It's quite a daunting task to come into compliance with a new set of transactions, a elimination of perhaps some codes that we've been using for a number of years, and to communicate effectively with each other by the time that we are mandated to do that. So we are filing for an extension, and we would encourage all entities to file for an extension as well. It gives us more time to get it right.
Debbie, what are some of the other things that providers can do if they're not going to be compliant on the compliance date, and they will need to be compliant?
First of all, they really need to understand how HIPAA impacts them. And they can work with their clearinghouses, they can work with their vendors. We are working with our submitters, the large submitters, on behalf of many providers, and testing some of their data to see what it is that they need to do to make themselves into a state of compliance. We have found, for example, a lot of the data content today is situational, it's optional data content, but under the HIPAA regulations, it's no longer optional. You have to send this information. So the rules, the business rules have changed a little bit. Some of the data, as you had mentioned earlier, has gone away. There are pieces of data content that the providers don't have to send anymore, and depending on how they're going through things, that information won't make it onto the payers in a standard transaction. It's critical. And I think Wayne was going to speak to that a little bit about the gap analysis that these folks need to perform up front on their own business practice and what they're doing.
Yeah, HIPAA requires standardization. That's one of the major motivators, is to get us all talking the same language.
That's how we're going to save money, right?
That's how we're going to wring inefficiencies and cost out of the healthcare system. I think we all agree with that. To achieve standardization first requires an understanding of, well, what does this standardization mean to us? And that requires gaining an understanding of the regulations, what it means, what those regulations mean and how they apply to you, understanding and working, as we've said, with your various vendors, suppliers, clearinghouses, payer organizations, to see what services are available to support you in you becoming compliant, and then testing. I kind of summarize it into my 4 gets. 4 gets? No. 4 gets. Get aware, get involved, get compliant, get testing. I'll add a 5th. If you haven't started already, get going.
Absolutely.
That's probably a byword for us all, get going.
A lot of times when I go out and talk with our payers and our vendor customers, I like to start off with administrative simplification, and how those of us that have been involved in the evolution of this kind of laugh at the simplification part of this. But I compare it to cleaning my kitchen. And most husbands will attest to, you make such a mess before you actually get things reorganized.
When you say looks like a mess? Wait a minute.
But really, I mean, in order to get yourself organized and to get to a state of standardization, it is difficult to get there, but it is achievable, and we need to get there. But it isn't simple in the beginning, but the goal is to simplify.
Like breaking an omelet to make an egg. I mean, no, breaking an egg to make an omelet.
Yeah.
Exactly.
I hear you saying 2 things. First of all, Wayne, you've been saying that the payers and the providers are not in this alone. It is a partnership along a continuum, and that we are going to assist each other. So those are some of the things we can do. Additionally, Debbie, among your messy things over there, I hear you saying, and I heard John saying earlier, take it in pieces. Don't attempt to get your mind around the whole thing.
Sure, chunk it.
But do it in pieces. You understand that it's connected, but if you take one piece at a time, it's certainly going to be much easier for you to accomplish.
If you look at the entire guidelines, and you grab that book and you open that book, it's scary, and I can see why a lot of providers will want to push that aside and say, I don't have time to concentrate on that. Let me concentrate on my own business, and that's providing healthcare services, which is what I would like them to do. That's why trading partners are out there. They have every provider has a trading partner somewhere, whether it's a software trading partner, whether it's a clearinghouse, They need to talk to those folks. They will help them get started. We will help people get started. I think Debbie made it very clear that we cannot make a transaction compliant. What we're going to do is we're going to take their data and we're going to format it in a standard format required by the HIPAA guidelines. We can't forget, though, that there's 700,000 providers in the U.S. That's a lot. There's 3,000 payers, I think, that are out there. For them to do this themselves, if they were going to do this themselves, that's a lot of payers to try to connect to and to try to work with. That's why a lot of them, if they could work with one or two specific trading partners, it limits their visibility and the information they're going to get, so they can better make decisions on how they're going to progress. They have experience within their offices, their billing personnel, their registration personnel. Get them involved. Get them to understand some of this information. They know the business very well. They can handle some of this in terms of communications with their trading partners. But it's very, very important that they start the communication process and understand the basics of what they need to do. I think once they see it get started, they're going to see it start to roll a lot faster in the future.
John, you made a point about the 3,000 payers, and many of the providers deal with a lot of payers. I think it's good to bring out the point that they have to test not with just one, but with each of those payers. Isn't that correct?
And that's what a clearinghouse will do for you. What
Okay.
a clearinghouse does for you is, remember, what a clearinghouse does is it takes a lot of those edits and a lot of the functionality that these payers have, and we try to provide it on the front end so that when you send us a claim, we will take that claim and bounce it back to you without sending it to the payer if it doesn't meet some specific criteria. What we're trying to do on that end is help you do that. In other words, if you work with a clearinghouse, we're going to help you make those transactions compliant to many more payers than you will ever be able to do by yourself. Right. So if you try to do it by yourself, for example, you're going to have to send to your biggest payers, your Aetnas, your Cignas, all these different payers, Medicare.
Yes, because they do have to test with each one.
Exactly.
Either they or you on their behalf, somebody.
Exactly.
Has
And
to
a
test them.
clearinghouse can test with the Medicare intermediaries once on behalf of all their providers as far as making sure that the 837 has been interpreted the same way. There is, even though it is standard, there's always room for interpretation, and one of the issues that you're going to come up with if you have multiple trading partners, which those of us who do this for a living understand, is that everybody's going to interpret their version of how to use the 837 or the 835 transactions. And so you can reduce that amount of interpretation and variety by reducing the number of trading partners that you're going to be dealing with, and you can cut back your testing time.
But no matter who the providers are going to test with, they're going to have to start now, because it's not simple, send it in, find out what's wrong, send it back, fix it, and it goes through.
Absolutely. We thoroughly enforce test early and test often. As soon as you think you're ready, don't wait to be perfect, because if everybody waits to be perfect, on October 15th, 11 o'clock at night in 2003, we're all going to be in a bottleneck of trying to get testing done, and we won't make our commitments to our customers.
Financially, for us as organizations that support clearinghouses, it's important that we work with our providers. That is our business model, as well as it is the providers to get their claim and remits paid. What's interesting is, I think as well as WebMD, as well as Per Se, we've developed translators that will take information to get to the HIPAA compliant format. So there are areas out there that when you work with a clearinghouse that you can communicate to them that, hey, I may not be ready to send you an exact 837 or receive back an 835. We can do some work with you to help you get there. However, don't forget that that data that appears within that format is the provider, the covered entity's responsibility.
Absolutely.
It is not the clearinghouse's responsibility.
Wayne, you agree? Gloria, you agree? You represent the payer, not the clearinghouse. What about testing? What about the testing in your
Testing is
environment?
absolutely critical.
Absolutely.
Again, we have a new language that we're trying to talk and implement, and the effectiveness to make sure that we can get the message across, claims information, accurately within the standards is paramount to us keeping the quality and integrity of information coming in, and the timeliness and the quality and integrity of the information going out, payments back out. The better information coming in, the better information going out. The way that you're going to ensure and validate that you have that good information is through testing. That's the only way.
And the danger is I might not get paid the right way if I haven't done my testing. So.
And I was just going to say, just wanted to comment. As a payer organization, we have roughly 4,000 to 5,000 entities that communicate with just this one payer organization in the state of Florida. To migrate all of those providers, clearinghouses, vendors, senders to the new standards is quite a daunting task, quite a challenge. And if you want to take a look at it, to compress that into the compliance states that we have, people are going to have to come on in a clip of 400 to 500 a month if you assume that there is an uptake beginning in January of this coming year, for example. And every month that you compress that, it's just more and more. To get back to your point, we need to test early. John, I think you were bringing out this as well. We need to test very frequently. When we're ready to get going, let's begin testing with our trading partners that we're communicating data with.
So what I hear you all saying is that if a provider is your trading partner, you want to hear from them now. You want them to talk to you, begin to talk to you now about testing.
I think to expect that everyone in the industry is ready to go right now is probably not a valid expectation. I think what you do need to do is to contact and work with the individuals that you're going to be communicating to, whether it's a payer organization, a clearinghouse, and at least determine when you will be ready as a provider and when you will be ready as a receiver for that, and set up a schedule and begin to schedule now, prepare now, and where you can test, continue test
exactly.
now.
Right. One of the things that I would encourage the provider staff to learn prior to picking up that phone is, who is it that I'm supposed to call? Quite frequently, I'll get calls from providers, and my first question to them is, well, how is it that you're transmitting your data to us? What's your software? And they don't know. All they know is they push the send button and the claims go. And typically what they need to do is contact the person who they bought their software from. Start from there. What are you folks doing to get me the ability or the capability to become HIPAA compliant? Are you going to give me the new fields that I need, the new prompts that I need, the new edits that I need? And start there, because, or at least know who it is. What software are you dealing with? How are you getting your claims from your office or your billing service to the next step? Because Sue told us earlier, there's many steps between the provider and the payer.
From a Medicare perspective, Gloria, would you like to add anything?
Yes, we've been testing with our providers since early this year, and even though some of them have begun that early, I can tell you that not all of them have reached the point where they've gotten what we call a clean claim, where it's actually accepted and paid out. So that just gives you the understanding that we're not just testing for HIPAA. Remember, they still have to meet all the same front-end edits. All the things they had to meet before have to be very clean for the whole thing to be accepted. And as I've been out in the field working with the contractors in different states, they tell me that many of their providers test for months, partly because of HIPAA and partly because of those things that weren't fixed before.
I was going to say, it's probably not inconceivable to think that it would take anywhere from 3 to 6 months for a good test to come through.
Right. So, and I know some of you are waiting for the free Medicare software, which most contractors are making available about December
of this year, right.
And so immediately you get that, test, because at least it'll give you a picture of where you are, like Sue said and like Debbie said, and like I think we all reiterated, don't wait to be perfect. We could be waiting till the millennia for us all to be perfect.
Sure. Yeah, one thing I'd like to add, and it's really important, what we're seeing is the larger providers, the hospital, the larger entities, have really good programs. I think they seem to be on top of things in terms of where they're going.
Well, John, do hospital physicians have to do anything different?
Well, hospital physicians really are different than what I would call the office-based physician. The office-based physician, their model is, they usually have a software product in their office and have been using it for a very long time. And like Debbie said, press a button and sometimes don't clearly understand where those claims go. Hospital physicians, for example, if you talk about anesthesiologists, radiologists, anybody that mainly works in the hospital setting, they're special because for a lot of them use billing services. And those billing services get that data from the hospital in a lot of instances. So it's important that a hospital-based physician work with their hospital entity to they have to look at their access management system, the lab system, everything that produces data for them to bill their claim. They have to get involved. The good thing for them, though, is that, like I stated before, these hospitals, most hospitals that I've interacted with have very good HIPAA programs going on. So if they just get in touch with that HIPAA office and say, listen, I'm dependent on your data in order for me to bill my charges, for me to get a claim out the door. What do I need to do? And they'll get good help that way. But they are different than the office-based physician, and they're going to need to work through multiple trading partners of data going from the hospital to their outside trading partners.
John, if I am a provider watching this broadcast and I am just beginning my HIPAA readiness efforts, what are some key steps that you would suggest for me to take?
Key steps would be, first of all, we talked about this earlier, is understand really what you want to do first. If you look at the entire guidelines, it's immense, and you could get overwhelmed and almost force you not to move as quickly as you could. So you're going to look at the claim and the remit. Those are the two most important things you're going to look at. And you've got to look at your internal processes within your facility, in your office. How do you collect the data today? What data is going to be different that you need to collect? Debbie brought up another good point, that some of the data that you used to collect, you don't need to collect anymore. So really, it's that gap analysis. I mean, we've heard the term gap here a lot. That gap analysis is taking what you currently have in your application or your system and what HIPAA is asking you to do, and just matching it up and saying, okay, these fields and this information I don't currently collect. What do I need to change with my forms? What do I need to change with my process? How are my registration people collecting that information up front? Because collecting it up front is the key. And I know we've stressed this as software vendors in the past, but when you collect that information up front, down the line to the payers, you want that claim to get paid the first time. So it's that gap analysis, that understanding of your processes within your internal office. That's where you start, I would imagine.
One of the things that we have found in today's world, quite frequently the providers will tell you there is another payer involved on this claim. I'm sending it to Medicare, or I'm sending it to Aetna, but there's also Blue Cross of Florida involved on this claim. But they don't give you the detailed information about that other payer. In the standard transactions now, if you send any part of that information, and this is one of the ones that we talk heavily on when we go out and talk to our payers and our providers, the part of the parts are going to be a problem. Because when you create an 837 transaction from that data content, once you open the loop, sorry to use that technical term, but the grouping of information pertaining to a particular payer, it's required that all of that information be present. And that's, to me, key, where they might be used to just taking the destination payer, the one that they're going to send the claim to, and getting their information. Now they have to make a conscious effort up front to get the information. Not only do I need to know that Blue Cross of Florida is involved, but what's the ID for the insured member? And what is the tax ID number for, or the payer number for Blue Cross? So there's a lot of training that's going to be needed for the office staff, teaching them to gather this information in a different way than they did before. If they get the correct information, now their trading partners, their vendors, their clearinghouses can help them make the transaction in a compliant format. But we can't make up data. We have to have that data available to put it in the envelope, as Sue calls it.
So you're talking about two things, though. You're talking about the gap in that they're not collecting all the data that it's going to be necessary for the future, and then you're talking about the flow of the data, in other words, where they pick it up and when they pick it up.
Correct. And it's really, really critical that they learn how the clearinghouses and the software are going to be kicking claims back to them that today might not get kicked back.
And sharing with everybody in their office, because if the front-end person doesn't collect the right information.
Critical.
So gap analysis, education, and we
pretty much taught testing to death.
You know,
Early test options.
It's a cultural shift for them because they're going to have to do some things that they were not used to doing.
The misconception, I think, is that the providers don't have to do anything, that the vendors and clearinghouses are going to make them compliant.
We want to make them understand they don't have to do a lot, but they do have to do something. We don't want to scare them that it's overwhelming.
They're not completely out of the picture.
No, you know what's important to realize, a lot of people compare HIPAA to Y2K, right? And with Y2K, you really had to just wait for your software vendor to deliver you a new piece of software that contained that extra extension for the date, and you had to make sure you just collected that up front. And one piece of data that you had to really worry about in terms of an office or a physician or a provider. In this scenario, you have to really examine it. And when we talk about gap analysis and we talk about test, it's very important to do that. Now, if you have the ability in your office, in your business, to develop a small group of a project team, a small team that just carries that forward and does that for you, it's important that you as a provider don't step back and say, well, they've got it, I'm going to go do what I do best, and that's, provide healthcare services. You need to be involved because as the covered entity, again, you're responsible for making sure that that is happening. So you now have to take responsibility for this. Whereas in Y2K, you got a piece of software, deployed it, it was very easy to make that transition for a lot of providers working on vendor software.
That's a good point, John. We found within our organization, we started off thinking this was an IT project.
Right.
The same as John's talking, and we soon found that, wait a minute, this is going to change the way we do our business, this is going to change, we need legal people involved. Providers don't have quite the extent, but it was clear early on to us that this is not strictly an IT project. This is a business impact that we need to talk about and make sure that we're doing all the right things so that the claims get paid properly.
I think that's what if you take a look at the model extension form, it does kind of provoke that thought pattern so that you can write down or think out what you need to do in your office or come up with a compliance plan to help you get to the point that you need to. So I think as providers are completing that information, that they don't necessarily need to just fill out the form, even though it only takes 10 minutes. They need to think up through the processes to help them become, get to those steps to help them become HIPAA compliant.
Kassan, what's interesting about this is that everybody looks at this from, oh my gosh, look at what this is going to cost me. I'm going to disrupt my office. I'm going to have to pull people from the work that they're currently doing. And that is true. There is some cost to this. Let's not be naive and say that there's not. But let's look at what the return on this is in the end. I mean, ultimately, what we've all been trying to get to, all of us together,
saving money.
That's right.
Saving money, or
Saving time.
getting the most that you can get from providing that service. And what this does, by setting up your office in the front and setting up the data, doing the gap analysis, ultimately what you're going to get is a big return. What's going to happen is, if you look at the scenario today, okay, a patient comes in the office, sits with the registrar takes the information, it goes, the services are provided, the bill is generated, the claim is generated and sent out. In some instances, I'll say, because we have payers here, in some instances, the claim gets rejected. And why does that happen? Because the appropriate information isn't collected up front. What happens in that instance? Well, you don't get that information back for days or weeks. You have to then produce a bill to the patient or rebill the claim. I mean, you go out months before some of these things can get resolved. In this environment, you need to look at your total cycle in your business, because what this should do for you is provide you benefits by providing good foundations of data. And what this will do is get claims paid when they're supposed to be paid, because you're providing that information. You're not going to be sending out the volume of patient statements you used to send out, the follow-up that you do to collect this information, the bad debt that you may have to collect because you didn't collect that information. All of that on the back end are the huge benefits. So I want providers to clearly understand the benefits on the back end of doing this upfront analysis.
And I will say, contrary to maybe some opinion, the payers do want the good information coming in so we can pay it right the first time. The most cost involved in processing of claims from a payer perspective is in the reworks that you have to do. Whether because the information isn't there as you suggested, or any number of reasons. But it's the rework that is very costly. Someone has to touch it, someone has to process it.
The neat part about it is initially the providers may feel like they're gathering more information, but the goal for the work group, as they went through each one of the pieces of information that make up these transactions, was to say, I don't care whether it's Medicare, Medicaid, Blue, commercial payer, is this piece of information critical for processing a claim? And it became a required data element across the board. So your office staff isn't going to have to sit there and say, now wait a minute, this is going to the Blue, so I need it, but this is going to my commercial payer, they don't want it, and if I send it, they're going to reject my claim. The overall concept is to the provider, the ultimate goal is to the provider, if you complete a claim according to these rules, you don't have to think about who the end payer is going to be for the most part.
John, what type of cost savings will providers realize as a result of implementing some of these HIPAA transactions?
Okay, Sonia, as we talked about the transaction sets, clearly there's a lot that can be benefited from during HIPAA. Eligibility is, of course, one of those. Many providers, as we talked before, currently don't use eligibility. In the HIPAA environment, eligibility could be key for them in getting that true ROI payback that they're looking for. You know, when you look at eligibility, which the technical term is the 270 and the 271 transaction, you know, in today's environment, when you check eligibility, it's a manual process. It's a registration person picking up the phone, trying to get through to the payer, and then verifying information, and that can take up to 15 minutes at the best. And the cost for that could be anywhere between $2 to $2.25 per transaction. In the HIPAA environment, however, what you're going to expect to see happen on the eligibility side is when that information is keyed in during registration, it automatically sends off the 270, waiting for the 271 return, and that could take minutes to get that information back. And if you could do that within minutes, your cost per transaction is only about 25 cents. So on the eligibility side, the cost per transaction, as you see, is initially just the time for doing the eligibility check. Now, down the line, what does that mean? Down the line, that has huge potential savings for a provider. Down the line in generating the claim and receiving the remit is where that information becomes key in getting the claim paid. You know, we talked earlier about the work that has to be done on the backside. Hospitals and providers experience this today, the massive amounts of work that they do and the staffs that they maintained in order to do follow-up on accounts that are either pending or insurance companies are waiting for the right information because it wasn't sent. That eligibility transaction will be key for making that go through quicker. Approximately, some of the numbers that have been thrown out that I think are pretty accurate, about 80% of the claims that actually reject at the payer are due because the information on the front end of registration is not obtained. This could really clearly benefit the provider in terms of down the stream revenue generation. The other side that we talked about also was the claim. Of course, that's pretty simple when you think about it. An 837 as we talk, or the claim is actually generated and sent. Now the ROI on that, of course, is generated from the eligibility side. Also, that gap analysis we talked about, providing the right information and testing with the payers and with your vendors. The return on the claim can also be a huge value to the provider. You know, when you look at the costs for the claim, even just checking claim status today, it could take 20 minutes on the phone, cost you $3 in personnel costs just checking the claim status of one individual claim. In the HIPAA environment, with sending out the right transactions and receiving the response, you're looking at probably 2 minutes per transaction, and again, a cost of only 25 cents for getting that information back and automatically posting that information in your application. And then the payment. We talked a little bit earlier about the payment information that's received back. Many providers are asking that that information gets populated electronically. They see the true value of that. If I can populate that information electronically, then I don't need to have massive amounts of staff on the back end following up and trying to post these manually. Plus, accuracy of key data is also reduced. So when you look at that, you could take 20 minutes, $3 per transaction to get that posted within your environment. But again, in the HIPAA environment, you're looking at 10 minutes per batch. And when we talk batch, we can talk 1,000 claims, we could talk 100,000 claims, because remember, all of this is being done electronically. And again, 25 cents per transaction. So when you balance the manual effort versus the electronic effort, the ROI is just truly immense. And providers need to look at that as the positive spin on their business for approaching HIPAA.
You know, you guys have given so much information. So we can move on to the other questions, could you just sort of sum up what a provider needs to ask you as a clearinghouse or a billing service? Or?
Well, I think it depends on who you are, and this is one of the problems that we have, and it's why I was stressing, know who your immediate trading partner is, because that's who you need to contact first.
Okay.
They are the ones, whether it's the clearinghouse that you're going direct with or if it's a software vendor that you're working with, do your upfront homework, know what you're using, who sold it to you, and contact that person and start the dialogue going, what are you doing to help me reach a state of compliance? What do I need to do to get there? And then follow the chain if you need to say, okay, now I've worked out what my software is going to do, WebMD or Per Se or whoever the clearinghouse is, what are you doing further on? Or if you're going direct to a payer, then you need to start the dialogue with the payer. When can I start testing with you? Can I get on your list? Providers have to understand, as Wayne indicated earlier, there's this whole...
You have to squeeze everybody in.
And we've all got multiple, and you know, from the provider's perspective, I'm the important person, but when you get into the queue, you're going to find that there's a line of... You've got to get yourself prioritized with your providers.
Could you kind of share with us some timelines that providers may need to follow?
Sure, and they're fast approaching. Obviously, the first thing we have to think about, as we all discussed many times, is getting that compliance plan in for the delay rule. And it's just like your income tax. By midnight on October 15th, not October 16th, but midnight on October 15th. And not April. Right. The date that you were going to have to be compliant is the date you're going to have to tell us that you're not going to be, obviously, and get the plan in. Right. And remembering that even though the law says that you must begin testing by April 16th of 2003, we're all in agreement they should begin testing NOW now. And often. So then the new compliance date will be a year from the one that's currently here, October 16th of 2003.
Now, if I don't file for the extension, I have to be compliant on October 16th, 2002.
Absolutely, and I need to tell you that.
So why would you not file for the extension?
And you know, a lot of times you all, Wayne, follow suit with Medicare, and Medicare has stated their intention clearly that they intend, with a few exceptions, to begin not paying paper claims, to pay only electronic claims by October 16th of 2003. So that's a good indication of the way things are going, that we all need to just, what did you say, get on the ball?
Get going.
Get going.
Yeah.
That's even simpler, get going.
I'd like to ask the last question. Are there sources that offer free information about HIPAA?
Lots and lots of them. But I think you need to go to the ones that are very credible. I highly recommend to anybody that asks me those questions that they go to the WEDI websites, go to your WEDI SNP websites. At the WEDI SNP website, you'll see links to the different regional, SHARP, and CHICA in the North Carolina. Each region has their own regional SNP, being the Strategic National Implementation Process.
And obviously, all the ones you're talking about are linked from the CMS website.
Absolutely. Most of them have links to each other. HHS has some good stuff out on their website as far as the actual regulations, if you want to get into that nitty-gritty. And the Washington Publishing website.
I'd also seriously recommend taking a look at the medical societies and professional associations.
Absolutely critical.
They have some outstanding information to help providers and anyone that happens across the information along.
And remember, they can afford the lawyers that, you know, really can dig into this law.
The other thing they have done is a lot of the gap analysis.
Yes.
If you're a chiropractor or if you're a home health agency, they've done the gap analysis, and they've worked with the industry groups to make sure that the individual specialties are met within the transaction.
And they have an understanding of the flow in the offices and in the hospitals.
Checklists already developed to help someone through an evaluation of impact.
The other thing I would strongly recommend is going out to the websites of your payers or your clearinghouse and see what their HIPAA readiness packages and your vendors. See what they're doing to become HIPAA ready
Sounds like an excellent idea.
Absolutely critical.
Most of them are in doubt. When I teach my classes, they say, well, how do I know my vendor's ready?
Well, if you go to the,
Right.
for example, I know WebMD and Per Se, we have specific links on our website that talk about our HIPAA readiness, our programs.
Do you think all of them do?
Well,
do
the
they,
big
Sue?
practice management
Yeah.
vendors also have customer password links directly on their outside website so that they can actually get in and find out about the HIPAA work that's going on for the specific practice management system that they have. The other thing I would encourage is there are a number of good listservs out there that you can become part of.
Absolutely.
The HIPAA Live one, there is a very lively discussion
Before you go
going on.
Could you explain, because I know a lot of times I talk about listservs in my classes, and they say, what is that?
A listserv is something that anybody can join to become a listening member or become a participating member.
It's like signing up for a news service. Once you sign up, you get all the news coming to you.
That's correct. You get all the news.
It's a mailing list.
It's a mailing list. It's
Okay.
just an email
That's a
mailing
better
list
one.
that you actually put your name on. There are some that come from the OIG that I participate in, but there's going to hopefully be one specifically from the other parts of CMS and HHS specific to the HIPAA requirements. But there are also some like HIPAA Live, which are run by outside sources that just want to encourage the debate and the information flow. And there are weedy ones, there are SNP ones, there are any number. There are some associated with the very specific medical services that you provide.
But try to choose one or two because they do get voluminous.
Yes, they do.
Now, the other thing that we haven't really touched on, and I would encourage any provider who's brave and going to do their own 837, 835 transaction, is to contract with a large certification company that will help you through the testing process of your transaction before you actually start trying to test it with your trading partners. You can get certified as, and there are going to be some folks who aren't even going to start testing an 837 or an 835 transaction with you unless you have certified with a nationally recognized certification company.
You know, I hate to ask all of you, your clearinghouses and vendors, but they're going to, everyone out there is wondering, okay, that sounds like a good idea, especially to get through this next, but how much, can you give me a ballpark? How much is that going to cost some of these small providers to go through clearinghouses or vendors or?
Well, first of all, I think the small providers must ask their clearinghouse and practice management vendors if they're actually doing this kind of certification, and you'll find out the answer is yes. It'll be posted to most websites.
Not just certification, but also handling of their, getting them HIPAA ready. And
that's correct. But for some kinds of certification services, the providers may participate with the clearinghouse, with the payer, with the practice management system on their certification process and help them become certified. How much it's going to cost them will depend upon the structure of the business entity that is doing this kind of independent certification. I don't mean how much the certifier is charging, but how much the clearinghouse or the payer or the vendor is actually investing in here, and whether they're actually going to charge the customers.
And it's not,
That's why we're
it's not going to
asking
be
you.
a cookie cutter solution. It will
Right.
depend on which services they're using, how many services they want to use. It's going to vary.
they want to know if using a clearinghouse, those who haven't done it up to this point, is really a viable financial solution.
Well, you know, we talked about that a little bit earlier. When you talk about being on your own, so to say, you may have up to 50 to 100 key payers that you're dealing with. If you don't use a clearinghouse, you have to test with those 50 or 100 you know, key entities. So,
And you have to deal with their interpretations.
Correct.
And it becomes...
And when you talk about the cost of doing this, we also hit on this before, and I'm going to stress that there is a cost. In even going to the clearinghouse, there's a cost. But when you look at the benefits you get, especially with this, and the thing that Debbie and I were talking about earlier were there's really no adversaries in terms of HIPAA. Everybody is really focusing on this. So this panel is a good example on how do we get the message out that the provider community needs to get there. Use our assistance. Use your trading partner's assistance. There's a cost involved, but the cost for not doing it is much larger than the cost for doing
Absolutely.
it.
This broadcast is one of the many ways that the Atlanta Regional Office is helping healthcare providers achieve HIPAA compliance. Our office has established a HIPAA hotline and an email address to assist our providers with their HIPAA questions. The hotline number is area code 562-7181, and the email address is HIPAA-info, that's HIPAA info, at cms.hhs.gov. Thank you again, and good luck with your HIPAA compliance efforts.